Hi, my name is Matt Kline. I'm a data scientist at Circle Medical. Today I want to talk to you about the Net Promoter Score, or the NPS. The Net Promoter Score is used across many different industries and types of companies as a way to figure out how likely our customers, or in our case our patients, are to recommend us to a friend, family member, or colleague. The numerical response between a 0 and 10 is what guides this calculation that we use in so many places. We're not just looking at the average score that patients are giving us, but we're actually breaking down these responses into different categories to determine that final NPS score. We're breaking these responses into promoters, detractors, or passives. Promoters are those who give us either a 9 or a 10 as their likelihood to recommend us. Detractors are going to be those responses between 0 and 6 where they're not likely to recommend us. Passive responses are going to be those responses that are either a 7 or an 8. We take the percent of responses that are considered to be promoters, and then we subtract the percent of responses that are considered to be detractors. So based on this formula, we can see that the NPS score can actually range from a -100, where you have all responses that are considered to be detractors, or a +100, where every response is considered to be a promoter. This scale does help to highlight that negative experiences can really impact this likelihood for a patient to recommend us. On the other side of the coin, positive experiences really need to be incredible for them to be likely to recommend us. Let's take a look at a few examples based on just 3 NPS survey responses. Our first example will be a 5, an 8, and one response gave us a 10. So we have 1 out of 3 promoters, and 1 out of 3 detractors, and then that passive response doesn't really get calculated except for the denominator. So we're taking 33%, which were the promoters, and we're going to subtract the 33% that were detractors. So that final NPS score is actually 0. Let's take a look at another example where we get 3 responses, all that gave us a numerical score of 8. In this case, we have 0 promoters and 0 detractors because all of those are considered to be passive responses. Again, we end up with an NPS score of 0. Our last example is going to be a response of 9, a response of 10, and a response of 0. So in this case, we've got 2 out of 3 responses that are promoters, or 67%, and then 1 out of 3 responses is considered to be a detractor, so that's 33%. When we make our calculation here, we take 67 minus 33, and we get a total NPS score of 34. So what is a good NPS score? Any score that's above 0 is considered to be a good NPS score. Anything above 20 is favorable, above a score of 50 is excellent, and a score above 80 overall is world-class. Here at Circle Medical, we're striving toward that score of 80 overall. We want to really provide that world-class, delightful experience for our patients. We send our surveys 72 hours after a completed appointment. We do only send 1 survey every 30 days per patient so that they're not getting a lot of extra emails. I hope that this has clarified a little bit about how we use the NPS score, how it's calculated, and the fact that it's applied across many different industries, so it allows us to compare ourselves to other similar companies. If you have follow-up questions about the NPS score, please feel free to reach out. Thanks for listening and have a great day.